Nanomedicine. Cool, isn't it? But you wonder, what is actually nanomedicine? We all more or less know what medicine is. But nano, a billion part of a meter, something really, really, really small. So imagine you have a human body, my body, about 4 meters, more or less something like this. Okay, something like that, very better. And try now to divide in 1 billion parts. Man, this is very, very small. So you must think but we actually do have something on the human body of that size. Actually, we do. So if you saw in the slides, you can see when we're going down to the nano level, what we actually have in the human body of this small size. Well, we do have the viruses. Some of the viruses are already 100 nanometers. But more important, we have proteins, DNA, atoms, collagen. All these names are very familiar to you. These are actually the targets of the actual current medicines. So what nanotechnology has done to have this new field of nanomedicine? First, this. You wonder, what is this? Okay, so nanotechnology has gave us the possibility to visualize very small things at very high resolution. What you're seeing here is a picture, it's an atomic force microscopy picture of a single molecule of DNA. Look at it twice. Why I say it like that, high resolution, because the development of nanotechnology allowed me to do it in liquid. Liquid increases the resolution. But I'm a biologist, I'm doing medicine. Everything I need has to be in liquid. Okay. But one of the things that you see here is just one molecule of DNA, but you feel it. It's all over-twisted. It's like all wrapped. And this is the native structure. This is how the DNA is inside the cells. As a matter of fact, I don't know, but did you know that you have 2 meters of DNA in every single of your cells? All there, over-twist, compact, packed on the nucleus. Okay. So finally, we have the technology to see not only a very high resolution, but on the native structure. I want to show you this picture because this very image, is the guilty, so to say, that a biologist like me moved to the physics department. When in physics I saw that, it's like, well, I'm not going anywhere, I'm staying here. So now I can see DNA, proteins, in the real native structure. But nanotechnology has given to medicine another important step, where we call it nanomaterials. We have nanotechnology, call it nanofabrication, that allowed us to do, for bigger structure, like, for instance, let me show you this ring, a silver ring, we can make them small. We can make them at the nano level. Okay? We have tools for this. At the same time, we have tools that allowed us to put atom by atom together to reach the nano size. Nanomatter, of whatever is organic or inorganic, nanomaterial was finally described in 2010, 2011, that at least one of the dimensions has to be equal all over 200 nanometers. So finally, 2010, 2011, in Science was yesterday, we have a measurement. Okay, now the important thing, no matter what you are applying to medicine, to communication, every of us that we work with nano, we realize that sometimes it's very useful, but it's very difficult as well, that all these new nanomaterials have completely different properties of what we know about them in macro level or atomic level. So for me, as a biologist that have no idea about the nano when I started, it felt like, do you remember the periodic table that you have when you were a kid studying all the elements? So actually, I feel like this. If I give it a new dimension on this periodic table, lots of new properties are in our hands now. So what nanomedicine does is to use and research what are these new nanoproperties and how we can actually use them to fulfill the needs that we have in the current medicine. So this was my first nanoparticle in the lab. These are very small silver nanoparticles. Actually, it took me about 4 years of basic research to make them small, to make them stable, same shape and same size. Whoever told that this is easy, absolutely not. During those 4 years, I did something actually really good. I want you to check it out very careful, this image. So on the top left, you have a normal bacteria. Happily, it's an image of an atomic force microscopy images. But what you have in the middle are two individual bacteria cells completely exploded. It's like all the insides of the bacteria has gone out. It's like a Jack the Ripper fashion, like everything out. So why this thing happens? So what happens, we were actually doing is interacting this bacteria with these silver nanoparticles. And what is this? Actually, this is a new generation of antibiotics. It's a new way that we have to make new antibiotics that actually work in completely different way than the ones that we have now. And that's actually, we are very much in need in medicine. In parallel, because obviously in science you cannot just be 4 years doing one thing and then another one, so in parallel, all together, I came across to this nanostructure, the single-wall carbon nanotubes, very used in all different fields of nanotechnology. And back again, I thought, well, let's try this one. When I tried to put it in liquid, remember, I'm a biologist, we need everything in liquid, again, wherever these new properties are, either aggregations, like terrible. Okay, so years and years, but finally we overcome the problem of aggregation in liquid of majority of the nanoparticles. Keep in mind this image, and I will tell you now what we do with them. But when we think about the needs of medicine right now, unfortunately, I have to say that majority of you, and I'm really sorry for that, but majority of us, we always have a close friend, a family, a colleague that at this very moment is going through chemotherapy. Chemotherapy drugs are meant to kill all the cells that are in division. So cancer cells are growing really fast and are always in division. So indeed, chemotherapy drugs kill the cancer cells in a very high dose. But at the same time, it kills every single cell that's still alive in your body. And that's when you have your friends, your colleagues, going through this treatment, you see them losing the hair, losing the nails. But the worst is that slowly their immune system is destroyed. The immune system is needed to be fighting against the cancer, but the drugs are destroying it as well. So we left these people over chemotherapy treatment open to whatever infection and whatever problem that they have. So I keep thinking, okay, how me, Nano, can actually help on this, So I was thinking, I thought, I designed, and I managed to do this. This is a small single-wall carbon nanotube. Actually, this was the first one I made. But if you think, you see the red and the green little things? They represent, it's a cartoon, they represent the chemotherapy drugs. The one that I have right now that even works better, these little balloons are outside on the surface of the nanotube, and I wrap in a very specific way a DNA molecule that is actually making like a raincoat. It's protecting the drug and the nanotube, okay? So this DNA, in the way that is covering everything, we already have achieved one important thing, and it's that the drug is more stable. But I want to go further. I want to move there. So what I'm doing is actually want that this drug delivery is only targeting cancer cells. So I can take the drug only on the place that I want, to the tumor cells. And you wonder how I'm doing this, okay? So we know that actually cancer cells and normal cells are very, very different. It's been known that on the surface, the protein surface composition is different. So that's the way I started at the beginning. So now I have this nanotube that are actually selecting cells with these different protein compositions, are selecting already the cancer cells. When the nanotube will go inside, by itself, it will remove the DNA without me doing anything, exposing the drugs to the cells. But I want to be even better. I want to have it even more efficient. So in the lab, we developed a tool based on the atomic force microscopy that allowed us to measure the mechanical properties of cells. What I mean? How I know if a cell, so I know now if a cell is soft, is hard, it's everything, what it is. So finally, we have a methodology that allowed us to measure the properties of the cells. And what we find out is that the cancer cells are softer. Cancer cells are more permeable. So now I feel like a molecular detective, interrogating the cells slowly to be able to target these physical properties, not only chemistry, but physical properties, and make a really, really smart drug delivery system. So at this moment, I'm here. I'm trying to bring these two guys together. And actually, I want to go even more than that. And then is when I've been blamed, or a lot of people say, I'm being so ambitious. Okay, so what I want about this, what is the aim for me on this? I want soon to have a pill full of nanotubes that you may take once per year, once every 6 months, I don't know. But the body is there, the nanotubes is there, and together with your immune system, as soon as you have 1 or 2 single cells that become cancer cells, you can target it. We don't need to wait for the tumor to be formed. Okay, I told you, it's ambitious, okay? But I'm there, working on that. So when my friends, my family, when I explain this project, they always say, okay, Sonia, this is cool, this is great, but can you tell us when we're going to have it in our hands? When it's going to be commercial? And I have to tell you, this is the worst question I've ever been asked. For me, for the science part, we're nearly there, but we still need a lot of basic research. And the funding from basic research has dropped down quite a lot. Absolutely as well, we need to go to clinical trials. Clinical trials are very long and very expensive as well, so we need to wait. But there is something that I already have done here. We already have done the working in nano. This is far too complex for me. I'm a biologist in physics. I'm learning physics, but I need to know chemistry, engineering, medicine, maths. I need to work together with all my friends. I need to bring collaborations, and all together we will make this moving. And this is already happening. Nano has already changed the way that we do science and we do medicine. However, how you choose your collaborator is not easy as well. So the answer to that question is maybe between 3 and 25 years. I don't know. So I only had time today to tell you about 2 projects that we have in the lab and some of the things that nanomedicine is doing. But I actually hope that I have convinced you that nano, indeed, is really small, but the potential applications are huge. Thank you very much.